Before going to the main topic today, which is basically the costing of an intervention, I want to give you a couple of understanding about the cost. There is a basic difference of full cost analysis and an incremental cost analysis. So you have to be very careful, and when you do a costing of an intervention, you have to think whether you will be doing a full cost or an incremental cost. Ideally, in an intervention, we look at the incremental. Now think about it. Let's think about the epilepsy program in the country. Okay, the country has a mental health program. Within that, there is there is an epilepsy program. Okay, if you want to cost of delivering the whole epilepsy program, that is the full cost. That is, you are looking at the whole thing of the epilepsy program, and you are trying to cost the program. So that's the full cost analysis. Similarly, think of routine immunization program. The government of India, which the government of India runs. If you want to understand the cost of delivering routine immunization program, that's the program cost. That's the full cost analysis. Think of COVID-19 vaccination. Think of a new intervention in the epilepsy program, something new you are adding in the program. Like the COVID vaccine was added in the whole immunization program. It was a component added to a program. And if you want to estimate the cost of this addition, that is the incremental cost. Because you are not looking at the whole program. The program is running as it is, but you are including a component in the program and you want to cost it. That is the incremental cost analysis. Generally, when we do an intervention, think about any intervention, meaning that you are doing something extra. Whenever you are doing something extra, and if you want to cost it, naturally, this is incremental, right? So mostly, any intervention cost, like the extra or something new you are going to do, generally, those are incremental cost analysis. Let me know if you have any questions. I will go in further detail with examples, but still, if you have any questions, please feel free to ask. There is something in the chat. Oh, that's just hi. Okay. Now the question is the difference between average cost and marginal cost. That is another confusion I have seen among many. What is marginal cost and what is incremental cost? Okay, so there is a difference between these two. Average cost, I'm sure all of you know. Total divided by number of outputs, whatever it is. So basically, if your cost is 100 rupees and your output is 10 rupees, 100 divided by 10, simple average, the way we do average, right? So its average cost is also that, like total cost divided by the number of outputs, whatever output you have. Total cost divided by number of children vaccinated, total cost during suppose total training cost divided by the number of participants. That's the average cost. Okay, it's a very simple thing. Total cost divided by the output. Marginal cost is, suppose, think about our training session today. Okay, think about that this training is happening. Training was supposed to happen offline, like face-to-face. In a face-to-face training, there were several requirements, right? So we have to have a venue for which we paid. We are supposed to pay for that. We may be having some training material for which we paid. And then there could be some refreshment, or there could be some tea, snacks, etc., for which we will pay, etc. Suppose in this training, we were expecting total 40 participants, okay? Now, suppose in that training, at the end of the day, we found that there are 41 participants. So now 40 to 41, there is a single unit change. But there will be a change in the cost also, right? Venue cost will not change. What will change is training material. If I had only 40 training material, if I have to prepare another training material, all this printing, photocopying cost will increase for one person. Refreshment, tea, snacks, for that one additional person, there will be some increment. But the venue, the audiovisual system, the my time, etc., will not change, right? For this additional person. That's the marginal cost. Just one unit of addition of something, what is the change? But incremental is not one unit. Incremental can be many units, right? Incremental is you are adding something in the existing system which can lead to many units of change. And you don't know, I mean, we never do incremental for one unit change. We never do that, right? So basically incremental is an addition and then the cost. But marginal is very clear that 40 participants to 41 participants, what is the addition? This is generally applicable in the production process. We generally do not much use the marginal cost. We use the average cost and then we go to incremental cost, okay? But please, when you refer to any cost, don't say that we are going to calculate the marginal cost unless and until you are really looking for the marginal cost. Like you are really looking for one unit change, what is the cost? Rather, you will be looking, I'm sure you will be looking at the incremental, like you are doing a new thing and you are looking at the cost of that and the output of that. So this is one. Then the second thing is, this is a very important concept, okay? This is direct and indirect cost. Direct cost is something which you can directly put in any function or in any activity, okay? Say, for example, in a vaccination program, vaccine, syringes, that can directly go to vaccine, and syringes will be used for vaccination program only, right? It cannot be used for any other purpose, isn't it? So it's a direct cost. You can trace those costs and directly put in the activity. Say, for example, the example of training I gave you just now. Venue hiring, the venue hiring, the payment to the resource person, or the snacks and these things, everything, you can just put a heading called training, because this you can directly see that you can put it in training. But there are some costs which are extremely difficult to put in one activity. It is very difficult to trace one activity, and actually that cost will be distributed in different activities. Say, for example, in a hospital, you see that the electricity is everywhere, right? The hospital is the electricity or water or telephone is everywhere in a health facility, okay? Now, suppose you are costing the immunization program, or you are costing the NCD program of that hospital. NCD is a component of the whole system, right? Think of any health facility. You can think of like even small facility. Think of a like lower level facility, which is primary health center, or for other countries, whatever is the lower level government health facility. Think of the facility. There could be 4 or 5 rooms. All the rooms have electricity, all the rooms, some of the rooms have water, everyone uses that water. But suppose you are looking at only the cost of doing NCD screening in that facility. So that's not only the function of that PHC, like the primary health center or whatever the facility you are thinking, right? That's not only the function they are doing. They do a lot of things, and lot of other things use electricity, right? Everyone use the electricity. Everyone use the maybe most of the services use the vehicle. The most of the services use the space, right? So now question is, how are you going to apportion those? I'm not talking about overhead and all this. I'm talking about the shared cost. Electricity is a shared, what we call is indirect, and then coming to shared cost. Why shared? Because it is shared across several services, right? So you cannot directly put electricity in one service, can you? You can't. Think about it. You think about all the programs that run in any of the facility, and think how you are going to put electricity for one purpose, vehicle only for one purpose. Vehicle can be for transport, vehicle can be vehicle can be for vaccine transport, vehicle can be for supervision monitoring, vehicle can be for meeting training. So it is shared. There is only one vehicle which is used for all purposes. Here lies the issue of distribution, of apportionment of the cost. And that's why it is said that it is indirect cost. It is not direct, it is indirect, or most commonly used as shared cost, because this is shared resources. Think of the nurse, like the facts. A&M, what we call here A&M, I'm not very sure about what Bangladesh or Indonesia, the person who does the ground level work, like all these vaccinations or community engagement or anything, what the person is called, think of that person. That person is responsible for several things, right? Family planning, immunization, maternal and child health, NCD screening, cancer screening, what not. They do whole lot of things. Now, we are not going to calculate everything. Suppose we are calculating only one thing, the NCD clinic. So I have to figure out, no, what is the person's time for NCD clinic only? That is what is called shared cost. And that's the, I think, in the cost analysis, that's the most challenging thing to do. Okay, so there is a question. Let me quickly see, madam. But when we check incremental, we usually report or interpret as for one additional life. We say it's not. We say that for this much incremental change, like suppose when you are doing you go ahead, I mean, you were talking about incremental cost effectiveness ratio, which we will be talking later in detail. But what we do is we see there is a control situation and there is an intervention. We see the changes. It cannot be one unit change. I mean, it is. So what we look at is, suppose what we call is DALIs. I really don't want to discuss this now because this may create further confusion. So suppose we are thinking of, or think about like hospitalization. I'm thinking about like COVID reduced. Before COVID, there were 1,000 hospitalization. After COVID, there are 900 hospitalization. What is the incremental? 100. 100 is the change. It's not one, right? This is how we interpret. Like we look at the control, we look at the intervention, and what is the change? And that change cannot be one. That change is, as I mentioned, 1,000 hospitalization, 900 hospitalization, the change is 100. So 100 is my unit here, and that there will be a cost change that we'll consider. So that's how we interpret the incremental cost effectiveness ratio. It's not marginal cost. It's ultimately the incremental cost. It's many units. Think about it. It's not single unit. Hope this clarifies. but it will be further clarified when we talk more about those incremental, the cost effectiveness ratio, etc. But it is not, think about it, it is not one unit, just one unit. Okay, great. Now go to, okay, now coming to a concept which is called annualization. I told you earlier that, if you remember, I told you that capital items are which will last longer than 1 year. But we generally cost for any program or any intervention. Generally, the intervention can be, we generally do the intervention cost during the period of intervention. Okay, so suppose the intervention was for 4 months, we do the cost for 4 months. Intervention, if it is for 1 year, we do the cost for 1 year, right? So we take into account the whole intervention period. When we do a program costing, any program, like the way I gave you the example of NCD program or epilepsy program, if I do a program costing, it will be for 1 year. Always one full financial year. Why? Because there are a lot of fluctuations, which it says, like general fluctuations. If you take the whole year, then all these fluctuations, they got adjusted. Okay, so that's why the rule is that for doing a costing, a full costing, you need to consider one full year. Now, the question comes in for the capital items, because the capital item, as I'm saying, it lasts longer than 1 year. So you have to figure out what is the cost of the capital item for 1 year, right? Because the refrigerator, it will run for 10 years. So you cannot put, I mentioned earlier that you cannot put whole refrigerator item cost in 1 year. You can, if you remember that I talked about fiscal cost, financial cost, and economic cost. So if you think of putting everything in 1 year, that is your fiscal analysis. But if you are looking at doing an economic cost or financial cost, you have to find out per year what is the cost of the capital item. And that's what is annualization. Annualization actually gives you that estimate of the cost of the capital item particular for a year. What are those? When do I annualize? As I say, for capital items which last longer than 1 year, computers, microscope, whatever, building car. Okay. How do I analyze? This is the formula. You will get, it's a very simple formula. You will get it. You just put it in your Excel. Exactly this is the way, and you will get it. Now, there are a couple of things here. One is the purchase price. Purchase price is the price at which you bought the item. If you don't get that, in most of the situation in government setting, if you want to do a costing of any program, you will find that you are not getting that information. What is the purchase price? Then take current year price. That is also okay. Useful life. How do I know the useful life of any item? I'm coming to that. Discount rate. Discount rate is an interesting concept. Suppose I bought the capital item today with 10,000 rupees. I am going to get the benefit till 10 years, right? Now, 10 years, after 10 years, the benefit will be less than what I'm getting now, isn't it? So for the 10 years benefit, if I have to take it back to this year, I have to use something to discount this, because the benefit, I prefer the benefit now. But in second year, benefit will reduce a little bit. Third year, benefit will reduce a little bit. And that way, in the last year, you will have some benefit. But my objective is to take this 10 years benefit to today's cost, right? So that is what is the discount rate. There is no. this is what I was thinking, that these will come in. Annualization, same as depreciation. No, depreciation is something different. I was about to say that don't get confused about the discount rate and depreciation. It's something different. That's what I'm explaining now, that depreciation is not the annualization, okay, or discount rate. From product warranty, okay, I'm coming to that. You are asking about useful life. Yes, I'm coming to that. But see, I'm trying to tell you again what is the discount rate. The benefits I'm going to get from one capital item over the year, the benefits in terms of money I'm going to get, because suppose if I told you, you remember that I told you that everything has a alternative cost, right? If I would not have bought this capital item, I would have put this money in my bank, maybe, right? That's the alternative option I had, because I bought this, now the refrigerator, I lost this savings. Otherwise, I could have put it in the bank. If I would have put it in the bank, I would have got a benefit, right? So that benefit over the time, that benefit in terms of bank, there will be a benefit. In terms of your item, the capital item, there will be a benefit. But what I'm trying to do now is that the benefit was supposed to be for 10 years. But for my calculation, I need to bring it back to this year when I'm doing the calculation. And that's the discount rate. Now, the discount rate is, it can be the country's central bank fixed deposit rate. It can be, one way is that, using that, any countries, like for India, Reserve Bank of India has a rate. That rate, fixed deposit rate, that rate can be used. For Indonesia, the central bank must be having a rate. Bangladesh, there must be a rate. That rate can be used, but generally in economic evaluation theory, we straight away use 3% discount rate. This is a commonly used discount rate, but in some of our studies, we use different, like the Reserve Bank of India's rate. Okay, we use that. It's up to you what you want to do. If you do 3% discount rate as the theory, the literature says, go ahead with that. But it is always better to do a sensitivity analysis, because this discount rate matters a lot. So I hope you understood. Depreciation is something different. I want to clarify this. Depreciation is the cost of wear and tear of the capital item. So the capital item, when you start using, it will not function the same way as it is doing today. Suppose you bought it today, after 10 years, it will not work the same way. Every year, it will have some depreciation. That's because of the usage. Usage of this capital item will decrease the productivity, I would say, the functioning of that. And that's the depreciation. Depreciation is different than discount. Discount is a benefit I was supposed to get from that. Okay. Now, this is the formula. As I said, discount rate, you can fix it at 3%, but you can also use the country's country's central bank deposit rate. And useful life, there is a question. Okay, good. I hope this is clarified. And the useful life, so yes. So your question was from the warranty. Yes, that's what I'm saying, that manufacturer specification often for some product, for the manufacturer themselves says, because when you do some studies again with the government, that you will know that they say that, oh, this microscope will last for 3 years. The specification says that, manufacturer specification says that the life is 3 years. You can use it for 10 years, doesn't matter. But its life is 10 years, okay? There, in the accounting rule, there are some like rule which says that these items will last for this many years, this item will have the life for this many years. You can take those. And you can take these assumptions like mechanical items can be 8 to 10 years, furniture can be 7 to 10 years, glass items can be 3 to 5 years. And building can be 20 years to 50 years. So basically, these assumptions come from the literature review. In our cases, we generally take furniture 10 year because most of the furniture, like the plastic or the wooden furniture, they last for 10 years. So we take 10 years. Laptops, if I remember correctly, laptops or, the electronics, those we consider 5 years, not more than that. Okay. Like very sensitive medical items, we consider 3 years. So there you can read the literature. Literature can, and for us, building is always 20 years. We don't go beyond 20 years for the buildings. But these can be, as I say, the useful life can be from many sources. And literatures are like the similar work people did, you can take from there also. It's fine to take those useful life from there. There is another concept which is called inflation. Here also, I have seen a lot of confusion among people. Inflation is the change in price. Okay. Inflation is the increase in the general price level. So when do I need the inflation related information? Why in a costing study we need an inflation related information? What is the problem? The problem is, suppose when you are doing a study, like the way I said before, that you are taking some data from the literature, which is 2009 data, suppose the cost data, which is saying that cost of, say, OPD visit for something, for psychiatric clinic. Suppose you are getting that cost for 2009 year, and you are doing the calculation sitting in 2024, but doing it for 2023. You know why? Because 2024 financial year is not ended. As I said, if you do a full costing study, you have to take last completed financial year. So that's the year 2023, which is ended. 2024 is still ongoing. You cannot get the full financial information for 2024. So that's why I said 2023. So you have data for 2009, and now you are sitting and doing the work for 2023. How to convert? You have to convert, right? You cannot just do 2009 data. You cannot use this for your 2023 study. You cannot. So that's the way to do the inflation. Because why I can't do? Because 2009, the price, you all understand this, right? The price in 2009 is very, very different than 2023. So suppose our OPD cost was $1 in 2009. Do you still think that it will be $1 into 2023? No, it would be something different. How will we get it? So that's what the inflation adjustment. What we call is inflation adjusted factor. And it's a very simple formula. It's a very simple formula. So you have the price for the first year. As I said, $1. That was my price for the first year. Indicator of inflation in the base year meaning this year, which year you are doing the analysis, meaning 2023. And indicator of inflation in the past year. Past year is 2009 as per my previous example. 2009 was the time when I got the cost. I want to convert it into 2023. So price in past year, you know the price was $1. You have to find out the indicator of inflation for 2023 and indicator of inflation for 2009. And then you just use the formula price in the past year multiplied by indicator divided by indicator in this past year and this year. Now, what is this indicator of inflation? What are you going to take here? I'm sure some of you, if not all of you, have heard about consumer price index. Consumer price index is basically an index which captures the changes in the price over the year. Every country will have consumer price index for several, not several, for all commodities that the country produces. So you have what we call is CPI. You have the CPI information, every country will have that. So you basically need that. Now I want to mention one point because this is what we do very regularly. Huh? That's why I'm talking about this. Annualization, all capital item needs to be annualized, and this in adjustment for inflation. Because in many a time we get the data from the previous year and we have to adjust for inflation. So these two are very basic thing which we really do in our analysis. Now, one point I want to mention, suppose you you get the inflation data in your local currency. So try to first convert it into local currency in the current year and then convert it into like a foreign currency or USD or whatever currency you want to do. I have seen that people straight away convert into USD from a local currency. That's wrong. Local currency to local currency, there will be transition and then it will be transferred into the USD or whatever currency you want to present. So that you need to remember that you first do it in local currency and then make it the change. I have an example for you, which I want you to do very quickly. You remember the formula, price in the past year multiplied by indicator of inflation, which is CPI in the base year is this year, like the year when you are doing the analysis, and indicator on inflation in the past year, like from the year you have the data. I have the data cost per bed day for 2010, which is $45. My consumer price index for 2010 is 160 by 80. Consumer price index for 2022 is this. I want the cost in 2022. Can you do it very quickly? 5 minutes. 5 minutes is also very long, but 5 minutes, not more than that. $45 is the value in 2010. This is the formula. $45 is the value before. 181 is the CPI in 2022. 160 is the CPI for 2010. And 45 was the value in 2010. I want to know what is the value 45 becomes in 2022. Answer in the chat in 5 minutes. Formula is this: price in past year multiplied by indicator in the base year divided by indicator in the past year. Great. You just took 1 minute. Great. Great. I know it's very easy, but I hope you are understanding how to convert the previous price to this year's price. Please, others, try. One, two, three, four, five, six. I got answer only from 6 of you out of 27. Why? What is the problem? If there is anything you are not understanding, please let me know. Okay, okay. I am hoping that you understood. Basically, what you have to do is your base year. Those who did not do it yet, please you can try doing it with me. So the base year CPI is 181.2 divided by 160.8, which is coming about 1.1268 or something like this. This is what is called inflation adjusted factor. This is the factor you took out, which is the adjustment which you need to do, right? So if you divide 181.2, anyone who did not do it yet, please do. 160 divided, it's divided by 160.8, it comes 1.126. That's the inflation adjusted factor. You just need to multiply this with 45, and that is 50.708, something like that. So that's what I was trying to say, that 2010 it was $45, 2022 it became $50 because of the inflation, because of the changes in price. So when you do this, you have to do this kind of adjustment. I hope this is good for all of you. You understood this, and please feel free to ask me if you have any confusion, if you did not really get it, what it is. If there is no more question, let me straight away go to the main topic today. And you will understand why I talked so much before going to the topic today, because you needed to understand these details. I am going to talk about an intervention where we did the costing as well as the economic evaluation, like the cost effectiveness. And that's why I chose this, because I can tell you how we did the costing, I can tell you how we did the cost effectiveness, and I can give you both a paper to read so that you understand how this costing can be done and how this can be used for your cost effectiveness. Okay. Now, to give you the brief of the intervention, it was intensified Mission Indradhanush. The name was it IMI. I would call it IMI from now. This IMI was a Government of India initiative to improve the routine immunization coverage of the country. So that's not the routine thing. That was something which was newly introduced by the government. So an intervention, it's not a full costing, right? It is clear now to you that it's not a full costing, because it was not the program. It was an addition in the program. Now, what was the addition? India in terms of immunization coverage, we struggle around. In 2018, when this program IMI was launched, it was about 67%, 65, 67%. Think about like now it could be 72% or something, the coverage. But the government wanted to improve that coverage to 90%. Okay. Now, improving the coverage from 72 to 90 requires some extra effort. That's the intervention, right? And to answer your question, I forgot who asked this question, but you asked that the effect, marginal versus incremental. See, I wanted to go from 72 to 90. I did not want to go to 72 to 73. I did not. That clearly means that my target will be some percentage, which is not 1%, right? So when I do the incremental cost effectiveness ratio, I will look at what was my baseline, maybe 72, and then where I reached. It could be 80, it could be 90, it could be 95, whatever. So basically what I am trying to say here is that the government of India introduced a new program to improve the immunization coverage in the country. What they did? They find out the states, and then in the states, the districts where the immunization coverage is very, very poor. They identified those, and then they did a special drive. They did like lot of campaigning, extra immunization sessions, not the routine one. Apart from that, they went to different places. The vaccinators sat there, vaccinated all the children, and came back. That happened for 4 consecutive months and 7 days in each month. Okay. So it was from October 2017 to January 2018, these 4 months, but it was from 7 of every month to 14 of every month. And that's it. Nothing will happen in between. Okay. So 7 to 14 every month for 4 consecutive months. So that is a new thing, right? So that's the intervention. What we did was we wanted to see what was the cost of doing this intervention, because the intervention is something new, which the government added. So incremental cost. Our perspective, if you all remember, I talked about the perspective, why it becomes so important, because you need to understand from whose perspective you are going to calculate this cost. We thought about government because we wanted to tell the government that, see, if you do this intensified mission Indradhanush, IMI, you will spend this much. And you will have per child cost will be this much. Okay. So that is what we wanted to tell the government. So that's why the government perspective. And level of analysis, I told you which level you need to think about it, like whether you are going to that national level or at the district level, at the state level. As I started, that they identified few states and few districts. Actually, IMI was a district level activity. They identified those districts where the immunization coverage is very, very poor. So they went to those districts only, and all these activities happen in those districts only, now nowhere else. So our level of analysis was mainly district, because the activities happen in the district, but the district has different levels, right? If you are doing an activity at the district level, this means you are doing at the sub-district level, you are doing below level, you are doing at the ground level, right? So in our case, and I know that Indian participants, you know about this, like sub-center, sub-district, which we call block, sub-district and district. But for outside participants, I'm not sure about like how it's called in Bangladesh or Indonesia. But I'm trying to say that you must be having the layers, right? Layers of health facilities. So in the district, and then you might be having a sub-district, and then you might be having a lower level health facility. So district meaning is the sum of all of three, all of these, right? So we did that. Here, why I gave you this exercise this morning, because you have to think about it. You have to try to think about what are your activities, what are the functions which you did when you were doing this intervention. Any intervention, when you are doing, you first have to identify the activity, the function. So basically here what they did was, the ground level staff, they went house to house in their respective areas. Okay. They went their house to house to see if there is any unvaccinated children. So they list it out. They prepared a micro plan, because see, they are already doing the routine service, but here they're doing an intervention, a new thing. So they cannot just sit where they are doing the routine service, right? They have to find out the area where the children are missing. I have heard that during my work, I have heard several stories, like why the children were missed, because they found that the children in one place, I remember they said, there is a small hill where they cannot go. They generally don't go. They didn't know even that up in the hill, there are at least 50 families living there, and their children never got vaccinated because they never come down from that hill. So those were identified. For example, in Assam, they told us that there are many places in Assam where those are inaccessible during 6 months of a year. Like whole 6 months, you cannot access those areas because of heavy flood. So then 6 months, children were not vaccinated there. Then think about like the brick clean area. Those are the migrant people, right? They go and come back. So they generally come back during the winter season. Here it is called Diwali. I hope the other country participants also have heard about this. So they generally come after a celebration we have called Diwali. So they stay there for 4-5 months and they go back. So their children, these IMI targeted those who miss the routine immunization. So that's the intervention. And for that, they did headcount surveys. They went to those places which they could not access during their routine session. They tried to find out who are those children who were missed in the routine session. Accordingly, they made a micro plan, a plan that, oh, see, I have to do a session here because there are brick clean workers here. I have to sit there to vaccinate their children. I have to go to the top of the hill to vaccinate those children. So those were the activities happen. Where this happened? At the sub-center level, at the below level. So you have to find out what happened there. Those are the activities at the sub-center level. Then every sub-center, like 5-6 sub-center, is the combination in one primary health center in our case. I'm sure most of the countries have these kind of like countries like us will have this kind of structure that a center will have below level 4-5 such below level. So these 4-5 people made this micro plan. Those needs to be consolidated, right? Because that needs to be pull up at the district level. Then there will be training meeting. Then there will be waste management. There will be vaccine transport. There will be communication. When I say communication, it's that letting people know that, oh, listen, we are doing this new activity to vaccinate your child. Come and get your child vaccinated. So you have to let people know, right? So those are the communication, the activities you have to. So basically what I'm trying to say here, that's why I gave this assignment today. You have to identify each and every activity function related to your intervention. And you have to identify at which level are these happening. If you are doing an intervention under your project, you have to find out what are the activities and who are doing those activities. So you have really to track those at different levels, okay? So that's the first thing you have to do when you are doing a costing of an intervention. So basic thing is that you need to understand the intervention very well first. Like if you miss out the activity, you miss out. That is, your cost will be underestimated, right? So you have to identify each and everything. Now, there are two things here. Again, I talked about this morning, capital cost and recurrent cost. All intervention will have some capital item and recurrent item. Actual expenditure, it is very easy to get. So, and expenditure, remember, not budget, expenditure. Here I always struggle. Whenever I tell anyone, it's not only IMI, I'm talking about all the studies I have done till date. When I talk about expenditure, they talk about budget. No, not budget, expenditure. So actual expenditure for vaccine and supply, fuel for transport, refreshment, incentives, etc., you can get from your expenditure sheet. Similar for your intervention, any intervention you are doing under your project, you can get those from your financial reports, because there will be a financial report. Financial report will definitely have all the activities for which the payments were made. Definitely those have those entries. So I would say this is relatively easy because this should be there. But again, I would say getting this information in a government system is the most difficult task because this is expenditure. As soon as you are asking for any expenditure data from any government sector, that they think that you are doing audit. They all like we were always like stamped as like the auditors, and we try to mention that we are not the auditors, we are the health economist team. But people think that because we are asking for so detailed information about the expenditure, and all actual expenditure happened for that intervention. Okay, so that's how it should be. The next component is the economic cost, because we wanted to calculate the incremental economic and financial. We wanted to calculate both. Now, economic cost meaning, I told you, is basically the time cost, or if there is any donated item, those cost, right? So now time cost. So you have different levels. I have the ground level, I have the sub-district level, I have the district level. So I have to pull out the activity-wise time spent for different persons for each activity, isn't it? Say, for example, I told you that there was a headcount survey. Headcount survey was done by the ground level staff, which is A&M in our case. A&M did house-to-house survey. So what I need to understand is, for doing this IMI, how many hours the one A&M spent in her area? How will I get this information? Face-to-face interview with the A&M. There is no other way to get this information because no one will record how much time was spent on that. So it requires a face-to-face information interview. But there are many A&Ms. There are many districts where these activities were done. So in your case, if you are doing a project intervention, then things will be relatively easier. But if suppose you are doing it in 2 different districts, there will be many A&Ms, right? Many ground level staff, many other staff. Will you interview everyone? No, you have to do a sampling. That's a different issue. I'm not talking about those, but I'm saying that this kind of information, time spent by different personnel for various activities, need to be collected through face-to-face interviews. Okay, so we identified the activities. These are not all, huh? I just gave you an example. Don't think that I'm missing out something. I'm missing out something, but not because I cannot fit in everything here. You can read the paper, which I'll be sharing after this session. So headcount survey, we figured out how much time was spent preparing microplan. We asked the A&M, how much time did you spend travel and conducting the session? Because she traveled to the new session site, sat there, vaccinated the children, came back. Then she prepared the report. We asked all this. How much did you spend? How long did you spend for this? How long did you spend for this? Then we have it at the sub-district and district level training and meeting, because this is a new area. There were training and meeting, lot of training and meeting actually. There was a very strict supervision. So we tried to understand how long the supervisors were supervising. We had new vaccine transport and handling. We had report compilation at that sub-district level, at the district level. So we took into account everything, like the person's time spent for each and every activity through face-to-face interviews. Now, coming to the calculation. How are you going to calculate the cost then? I know the hours spent for each activity multiplied by hourly wage. How I am going to get the hourly wage? Monthly gross salary of the person. Don't ask the monthly salary of individual person. Never do this mistake, huh? Because that's the most sensitive information in a costing study. Don't ask anyone's salary. What you have to do is, there are A&Ms, you ask the people that what is the average salary of the A&M in this district. I know the immediate answer you will get, oh, we have many seniors A&M, senior A&M, we have contractual A&M, we have like new A&Ms, like who are freshers, and their salary varies. We can't tell you. You say that please tell us whether your senior A&Ms dominate or your contractual A&Ms dominate or who dominates. There will be answer. Take the average of each group and try to find out when you are doing the interview whether the person is contractual or the senior A&M or how it is and where you are fitting in the average salary. Okay, so there are a lot of tricks. When you do this analysis, you will find these difficulties. But what I'm trying to say here is that you have to get the monthly gross salary and monthly total work hours, because I gave you this example, I think, earlier, that if I put my total salary for today's class, absolutely wrong. You have to get my monthly salary and my monthly work hours. I work for 5 days a week into 4 weeks, 20 hours, approximately 20 hours. Is 5 days a week, 8 hours, so 40 hours. 40 hours I work, but I teach for 1 hour. So 1.5 hours, sorry. So you have my monthly salary. 40 hours is my total hour, and for 40 hours I am paid for this. You can easily get my hourly wage, right? That's how you have to calculate the time cost for every person. Now, finally, your total cost. You got the actual expenditure. That was easy. If your objective is the financial cost, actual expenditure is good enough because you are not going to do the time cost. If you are interested in economic cost, that is the time cost, you do actual expenditure plus the time cost. You probably have noticed, I'm not sure if you have noticed, that I missed out some. I did not consider few items here. Can anyone identify quickly which items I never mentioned here? I talked about a lot, but I did not say I did not talk about few things, like few items. Can you identify, can any one of you identify which I did not mention at all? No answer. Did I talk about anything about capital item? No. Did I? Like I talked about human resources. Other than that, did I talk about vehicle? Did I talk about uh, like the area or something? I did not, right? So, but I am doing an economic cost. So I have to figure out how much time of the vehicle is used for this purpose, right? So those needs to be there. Those calculation needs to be there. But what I am trying to say here, what I tried to say here is the process. You have to identify your type of cost, perspective, and level of analysis first. You have to identify all the functions and activities and at what level. Then you have to find out what are the actual expenditure at different heads, because this will go in different heads of your cost. Then you have to find out the time cost for different activities and at different levels. Then you have to do the cost calculation. And then finally, you will get the total cost of the intervention. So that's all from my side today. If you have any question, feel free to ask as usual. You can put in the module also. I will give you a reference, exactly this reference, so that if you read, you will clearly understand what I meant today and how you need to do this. And I will go to the next one to talk about the economic evaluation part. Thank you all for listening and your patience. Thanks so much.